Yeah, so maybe to first talk about high-risk MDS. So I think there's really been a history of innumerable failed trials, including really several presented at EHA this past year. And so we're all eagerly awaiting the readout of two trials. One is the VERONA study, which is a randomized controlled trial of azacitidine and venetoclax versus azacitidine therapy alone. Clearly, this has been a paradigm shift in AML, really in all stages, despite just the label for elderly patients. And we really have very great and exciting data in MDS, both in a large phase 1 study and real world data from our centers and others, really shows composite response rates are much higher. I think there are toxicity challenges and will survival be improved? These are big questions. I think in the US there'll still be a lot of usage, whether or not the trial is negative or positive, but we're all kind of in a lull to how to design those future trials. The other main one to mention is the SELECT MDS trial, which is tamibarotene for RARA overexpressing. So again, another placebo-controlled trial for aza-tami versus aza alone. This is for RARA overexpressing patients, which is about 50% of MDS patients. And what we're going to know by end of the year is the CR rate. So in the first 190 patients, the data will be out by end of the year. And then the trial is fully accruing to over 500 for a survival endpoint, but the CR is the sort of key. And can we get earlier conditional approval is the big question if the trial's positive.